To start, there are generally two different types of floss: multi-filament floss like nylon floss or silk floss, and monofilament floss, which are generally made up of a type of rubber or plastic. Of these two, the nylon floss is going to be the most common. It's your standard dental floss and has been around forever. Nylon floss is a lot cheaper and it comes in all manners of thicknesses and flavors and can be bought waxed or unwaxed. Your monofilament floss is a newer technology, and since it's not fabric like nylon, it doesn't rip or tear. Since it's so strong, a lot of people think it's easier to use and pull between teeth. The plastic or rubber also seems to glide easier for many. In fact, many brands use the word glide in the floss name. There are also many types of floss formulas, like a fluoride floss or a tartar control floss or a whitening floss. To floss, use about 18 inches of dental floss. Wrap it tightly around your middle fingers while firmly grasping the dental floss with your index fingers, making sure to leave about 4 inches of space between your index fingers. In order to ease the floss into the inner proximal space, use a combination of your thumbs and forefingers to ease the floss into the contact and not force it in, thus traumatizing the gingiva. Forming a C shape, carefully slide the floss up and down between your tooth and gum line, rubbing the tooth about 3 to 4 times, and making sure to go as far subgingivally as possible. Change to a clean section when moving on to the next contact area. The circle method is good for children. You tie the floss in a circle and you move around the floss to use. The finger placement is the same as the method mentioned previously by using your index fingers to move along the floss and to help you insert the floss into the contact. There is no wrapping needed. Currently, there are only two options for floss holders. The first is the standard Y-shaped or slingshot or forked prong type, having two fixed points and the floss strong taut between the struts. The second is the floss awl. It is a new patented design having a single independent point. This type of floss holder is not shown in this video. Some of the Y-shaped floss holders are ready-made. You can take them out of their package and start using them instantly. Other floss holders need to be prepared or loaded. This video shows how to prepare a simple Y-shaped floss holder. The advantage of using a floss holder that needs to be prepared or loaded is the fact that you get to choose which type of floss to use. You get to choose taped, waxed, unwaxed, thin, tufted, etc. Here we're also able to see how simple it is to interchange the heads of a Y-shaped floss holder instead of having to restring or reload the floss holder. The longer Y-shaped floss holders have a further reach into the mouth. This allows for people with severe gag reflexes or smaller mouth openings to be able to reach and floss the teeth furthest away. When using these floss holders, we have to remember that we still have to ease the floss into the contact in a sawing motion and to wrap the floss around the tooth. These flossing tools that we see here, such as the pre-threaded flosser or floss holder, may be helpful for people who are just learning how to floss. It may also aid people with limited dexterity in their arms or hands, or people who are flossing the teeth of someone else, such as a child or a disabled person. There are also many methods and tools for flossing orthodontics, like braces, lingual bars, etc., and bridges. In this clip, we are using a floss threader and some floss tape in order to floss underneath the pontic of a bridge. The floss threader is inserted in the contact area, guiding the floss inside, then sliding back and forth underneath the pontic to remove the dental biofilm and debris. Superfloss can also be used in this method. Superfloss has a built-in small plastic floss threader on the end that is used to place the floss underneath artificial teeth or other prosthetic structures in order to use it. Superfloss is the most effective way to clean missing teeth that were replaced with fixed bridges or implants, both of which create places that cannot be flossed in a normal way. A gauze strip can be used for cleaning the inner dental surfaces of teeth adjacent to toothless areas, teeth that are widely spaced, or implant abutments. To prepare the strip, a 2-inch wide gauze bandage is unfolded and refolded lengthwise. The lengthwise edge of the gauze is positioned with the fold toward the gums and the ends folded inward to avoid irritation to the gums. The gauze is adapted by wrapping it around the exposed proximal surface to the front and inner line angles of the tooth. An outer to inner shoeshine stroke is used to loosen and remove plaque and debris. With yarn, gauze may catch on rough surfaces of dental appliances and become stuck. Therefore, care must be taken with use. In our field, we will need to be able to recognize incorrect ways of flossing. Some evidence of incorrect flossing include clefts or cuts that occur when the floss is not wrapped around the tooth but allowed to cut into the gingiva or inner dental papilla, often on the facial surface.